Hello guys, today we are going to talk about Angina pectoris, that what is Angina pectoris, and also we will discuss about the anti-anginal drugs in order to prevent anginal pain that often occur. So we have an overview about that what is Angina pectoris and what is the types of Angina pectoris, and next we will talk about the classification of drug used against angina pectoris, and the details of these drugs mean that classification, mode of action, all that used against angina pectoris. So you are welcome to my channel now. So let's see angina pectoris. As far as angina pectoris is concerned, so it is a condition in which is characterized by the severe pain in chest, often also spreading toward the shoulder, arms, neck, which is referred as referred pain. That is a general term used for it, that is referred pain. While it causes the inadequate supply of the blood to the heart. You may say the demand for oxygen is increased while angina pectoris. It is a squeezing pain, you may say, or pain in the center of chest, and this occurs when the heart muscle need more oxygen, as I have discussed in the above, that it causes inadequate supply of blood to the heart. So for example, during physical activity we often need some more oxygen. So what are the symptoms of angina pectoris will be discussed here in this video. So the most common symptoms are chest pain, discomfort. You will feel discomfort, a burning sensation, and fullness. You may say you would not feel hungry, and shortness of breath and dizziness, most common. So what are the causes that cause the angina pectoris? That is tobacco use. Tobacco use means cigarette smoking. Some disease also cause this angina pectoris, that is diabetes, which increase the coronary artery disease risk. And another disease that causes the angina pectoris is the high blood pressure. High blood pressure damages the arteries by accelerating hardening of the blood vessels. So now we will discuss about the types of angina pectoris. I have discussed, we are discussing the angina pectoris because when we talk about drugs, so we will be able to know about these. We should know about these types because we have to understand this drug too. So these are three. Number one, that is stable angina, that is also called typical or classical or effort-induced angina. The effort-induced angina is showing that this occur by effort, mean by physical activity, and these are characterized by the short-lasting burning, heavy or squeezing feeling in the chest just when we start to have a heavy or physical work. It is caused by the reduction in the coronary perfusion due to the fixed obstruction of coronary artery. While this occurs due to the obstruction, or you may say narrowing of the arteries of the coronary artery, and you may say it does not occur as sleep or rest because it is concerned with the physical work. you may say that occur when heart work overload, when the demand for oxygen become high. As the demand become high, so we feel about that angina, stable angina, and it lasts for 5 minutes, and it is the most common type of angina. Going toward the next, that is number 2, unstable angina. Unstable angina, it is also called as crescendo angina. Crescendo angina, maybe it is named after the scientist who discovered it. It is characterized by the chest pain that occur with increased activity, or you may say frequency, duration, or intensity than stable angina. It does not follow the pattern. You may say that it does not follow like a pattern as angina follow, like having a chest pain and pain spreading toward the neck, arm, etc. And it can be more severe than stable angina because you may see above line that it has increased frequency, duration, and intensity. It occurs at rest, sleep, and you may say that it occurs without physical activity. Same that rest or medicine may not relieve pain, mean that rest or medicine will not relieve pain, and as it is more severe, so it lasts for longer, about 20 minutes, and require hospitalization because it is severe than stable angina. It can lead to the aggressive health damage, and you need aggressive therapy too to prevent the progression to the myocardial infarction and death. Going toward the next types of angina, that is variant angina. Variant angina is also called as prince-metal angina, vasospastic angina, and further we will say that it is also called as rest angina. Rest angina, as the name indicates, that it occurs at rest. You may say, we will see in the next lines that what I say, that it is rare and uncommon. It does not follow the common, you may say, the common trend that other disease follow. It is characterized by the spasm of coronary artery, significant coronary arteriosclerosis. So it is characterized by the spasm of coronary arteries, meaning constriction of the coronary artery. It is not related to physical activity as unstable angina, and it always occurs when the person is at rest, sleep, or between the midnight and early morning, mean that it occurs in early morning, midnight, or sleep. You would be completely unaware of it, and you will have this kind of angina. Medicine may relieve this type of pain efficiently. As I have discussed that, we will discuss about the anti-anginal drugs. So we have a layout about the anti-anginal drugs, that what are anti-anginal drugs. So the drugs used against anti-angina, we will say that beta blockers or beta adrenergic blockers. These include atenolol, bisoprolol, metoprolol, and propranolol. This will be discussed in detail in the coming video. Next, we have nitrates that efficiently relieve about the anginal pain. These include nitroglycerines, isosorbide dinitrate, isosorbide mononitrate. These are including in nitrates. Nitrates are nitric oxide, you may say. Another we include that is calcium channel blockers that relieve anginal pain. These include dihydropyridines, which are further classified as amlodipine, felodipine, and one another, that is nifedipine. And we have a next class that is non-dihydropyridines. These are structurally represented It includes diltiazem and verapamil. And we have a next class of drug which relieve anginal pain, that is sodium channel blockers. These all will be discussed in the coming video. The sodium channel blocker include ranolazine. Beta channel blockers, that are, you may say, beta blocker, that are beta adrenergic blocker. The beta adrenergic blocker decrease the oxygen demand. We have a clear statement that it increases the oxygen demand of myocardium by blocking beta 1 receptor that is present in the heart. So when the oxygen demand is decreased, so we may feel a bit relief of angina. It results in the decreased heart rate and decreased cardiac output, same decreased contraction and decreased blood pressure. As all these conditions are induced, so we feel a bit pain because there is a narrowing of the arteries. So if these conditions occur, so we feel a bit relief. This can be used to increase exercise duration and tolerance in patients with effort-induced angina, stable angina, you may say. So these can be used, mean that we can increase our physical activity by using beta blockers. In vasospastic angina, beta blockers are ineffective and may worsen the symptoms, as it is not, you may say, ineffective in vasospastic angina or variant angina. Antianginal and metoprolol are preferred or non-selective beta 1 and beta 2 blocker, that is propranolol. So we mostly use antianginal and metoprolol, as propranolol is not cardioselective. Mechanism of action of beta blocker is given here, that you may understand that how the pain is relieved. So angina mean that excess oxygen demand. Beta blocker, we take beta blocker, antianginal or metoprolol orally. Then what happened next? That beta blocker reduce the oxygen demand by blocking the beta 1 receptor present in the heart. What happened next? That is the heart rate reduced, blood pressure reduced, contraction reduced. So all this happen, and we feel that we do not need more oxygen in order to run our heart arteries. So we feel normal, oxygen demand is really less, and pain is relieved. These occur these are the phenomena that really occur. So we are going to talk about now the mechanism of action of the next class. So here we have an artery that include you may say some channel, and we have an intracellular region and extracellular region. These are the calcium channel. Calcium get into the blood vessel, and the further calcium present in the smooth muscle, or you may say the vessel present in the heart. So these all bring the contraction, excitation to contraction coupling to the myosin phosphate phenomena, phosphorylation. So all these will happen, and the contraction occur as if the calcium demand is increased. Now the calcium channel blocker, this is the mechanism of action of calcium channel blockers. So when calcium channel blocker come, that block the calcium channel, and the calcium intake is reduced by the smooth muscle, it brings your heart to the relaxed state. Now we are going to talk about the nitrates, that what how nitrates overcome the anginal pain. So these are effective in three types of angina, that is stable angina, variant, and unstable angina. It includes short acting nitrates, that is glycerol nitrate, or you may say glycerol trinitrate, and we have a long acting azosorbide dinitrate and azosorbide mononitrate. Azosorbide, when taken sublingually, so it acts as a short acting nitrates to relieve the anginal pain. So we all discuss about the mechanism of action. Before going to discuss about the mechanism of action of nitrates, we will have a keywords, that is MLCK, GTP, or cyclic guanosine triphosphate. Okay, so that is SCAM and NO. So MLCK stands for myosin light chain kinase, cyclic guanosine monophosphate, and colmidine and nitric oxide. We have a sketch here to discuss about the mechanism of action of nitrates, that how nitrate work in our body to relieve the anginal pain. As angina is referred to the constriction of the arteries, mean that the arteries are constricted and the blood flow is reduced. Same, the oxygen demand is also increased as oxygen demand is decreased. So this is the calcium channel, and calcium get into the body, and we have some stored calcium present in the smooth muscle, and then it combined with the calcium plus CAM, calmodulin. So after that we have a general mechanism that cause contraction, that is MLCK phosphate, the phosphate bind with it, and then it bind with myosin. So myosin phosphate is formed, myosin phosphate and plus actin that combine and cause the contraction. This is the smooth muscle. And nitrodilator, now we have take a nitrodilator get into the smooth muscle. It is direct converted into nitric oxide, so it causes cyclic guanosine monophosphate, and cyclic guanosine monophosphate inhibit the calcium channel blocker and also the MLCK phosphate converting into myosin. So this was the mechanism. Now dephosphorylation of MLCK, this is the main point. Dephosphorylation of MLCK through cyclic guanosine monophosphate occur to dependent protein. So this is the last classification of our drug, that is ranolazine, sodium channel blocker. Ranolazine inhibit the late phase of sodium current. So we may say that late sodium current, INA, improving the oxygen supply to the heart. Have less effect in women than men. That is the main point that I've seen in a book, so I have mentioned here. That was all about. So thank you very much for watching my video. Keep subscribing and be happy. Thank you very much.